Hi, okay, so I have cystic fibrosis, and cystic fibrosis, so it is an autosomal recessive disorder. So this means that they have to inherit two recessive mutations from their parents. So, for instance, say you have two parents that are heterozygous, so they are capital A and lowercase a. And so in this case, they would be carriers. So they are symptomless and display no symptoms of cystic fibrosis, but do have this mutant gene. So if two heterozygous parents um, are to have a baby, then they would they would have a 25% chance of their child being a carrier, or that will not be a carrier and not have cystic fibrosis. Then this right here is two heterozygous, and so that means that they would have a 50% chance of being a carrier but not have any cystic fibrosis symptoms. And then down here in the bottom right, they would be homozygous recessive. So that means that they have a 25% chance of having a child that will have cystic fibrosis and display symptoms. And so, about 1 in every 31 Americans is a symptomless carrier for cystic fibrosis. And so, here's like a little example of how it is inherited. So, right here, you have someone that is normal, displays no symptoms of cystic fibrosis. And here's someone who has no symptoms of cystic fibrosis but is a carrier, so they have that recessive lowercase gene. And so with that, they can have a child that does have cystic fibrosis. So right here, they do have one, and they also have two children, or they have two children that are carriers, and then some that do not have cystic fibrosis. So the organs that are affected, and the main one that's associated with cystic fibrosis is the lungs. So a lot of people with cystic fibrosis do have a chronic cough, and they have a lot of mucus in their lungs, and it's very easy for them to have bacteria in their lungs, so they are constantly on antibiotics and stuff like that. Another thing that most people don't know is their GI tract is affected, so they have trouble digesting food and having it absorbed. So they actually are. That's why they tend to be very small, very petite, and have trouble growing because they are having trouble digesting and absorbing their foods. Um, Another one that most people don't know about is the reproductive system. So people with cystic fibrosis typically have decreased fertility, so it's very hard for them to have kids because of cystic fibrosis. Um, and then last but not least is the sweat glands. So the sweat glands is how many people test for cystic fibrosis. And so this is because most people with cystic fibrosis, when they sweat, they it's very salty and just they have a lot more sodium chloride in their um, sweat, which is how if you get tested, if you get a blood test for cystic fibrosis, that kind of suggests that you have it or you're a carrier. The doctors will take a sample from your sweat to see if you are positive. So here are some treatments. So over on the left is what this is for the respiratory, and this is called a high frequency chest wall oscillator. And so both kids are actually wearing it. And so what it is, it's kind of like it's a machine that vibrates your chest, so it can shake the mucus from the walls of your lungs and stuff like that. So it'll make it easier to breathe. The kid on the right has a nebulizer also, and that is to help deliver aerosol medications. So that is those two. And in this picture is what people call a G button. So a G button is a small tube that's put through the abdominal wall into the stomach so that they can put formula or food through. Because when you have cystic fibrosis, your diet usually consists of a high protein, high calorie, and high salt diet because you're having trouble digesting and getting all those nutrients. So that is an easy way to get nutrients, especially if you have a small kid. So cystic fibrosis is caused with the mutation of the CFTR gene. So that is the cystic fibrosis transmembrane conductance regulator. And it's actually, it is very easy for it to be mutated. And so in this image on the right, it shows that kind of the bottom of the channel can be closed, and that doesn't allow the sodium ion or the chloride ions to get through, causing that sticky mucus buildup. And there are 1,700 mutations for this regulator known, but not all cause cystic fibrosis. And so they're classified as a class 1, 2, all the way through 5. And that's just like different ways that the channel has been mutated. So this is Lisa. Lisa was diagnosed when she was 8 years old. Her mom's a nurse, and her mom knew their family history contained cystic fibrosis. And when Lisa was born, she was very small, and her mom noticed she wasn't growing. So she got tested, and it came back positive. And so now Lisa is in this picture, 25 years old, and she talks about in an interview her daily routine. And she does a nebulizer in the morning for 20 minutes, then spends 15 minutes sterilizing it. And after that, takes medicine that consists of vitamins, antifungal medication, and anti-inflammatories, antibiotics, and allergy medicines. And after that, she does puffers and nose sprays to kind of help clear her airways. So she describes that at least once a week she sees a doctor. But at age 25, her cystic fibrosis progressed a lot, and it declined her lung functions. So she is in the hospital at least once a month, and she describes that having cystic fibrosis is very hard. It's hard for her to keep a job, and it's very stressful for her to earn money. So at dinner, she takes enzymes to digest her food. She does percussions, which is like having a back massager, but you're putting it around your chest, and so it can vibrate your body and dislodge the mucus from her lungs. She works out, and not like lifting weights and stuff, but jumps on a trampoline and runs, so her body's moving constantly. And then she stretches. But sadly, when 2 years after her interview, she ended up dying to cystic fibrosis. But you can tell that now, before then, it used to be that people didn't make it to 18 with cystic fibrosis. And now more than 50% of the people are making it past 18 and into their 20s with cystic fibrosis. So a lot of it has changed. And that is it. Thank you for watching. Bye.